Hey guys, Karen here from The Rescue. So this one's going to be a little bit controversial coming from a rescue, but I recently received a little bit of online criticism over the neuter status of some of my own dogs. So I thought it raised an interesting and important topic, so here I am making a video. So let me start by telling you that I really hate blanket rules. One in particular is one found commonly in rescue, and that's around spay and castration. So my controversial statement for today is that I, nor my rescue, believe that every dog should be neutered, nor do I believe that it is beneficial for a large majority of dogs. So, let's discuss. So, neutering, which is also referred to as sterilisation, fixing or altering, is most commonly a surgical procedure which is done in male and female dogs and involves the removal of the sexual glands from within the endocrine system. In females, this is known as spaying, and in males, castration. When we castrate our males, we're removing the testes and the primary source of testosterone. And when we spay our girls, we're removing the ovaries in the uterus, or sometimes just the ovaries, and so we're also removing the gland primarily responsible for estrogen and progesterone. The procedure itself, particularly for females, is a pretty major one, which involves a general anaesthetic and approximately an 8 to 10 day recovery period. Although it is very routine and common, it should be remembered that we are removing organs from our dogs' bodies, and with that the glands, which are primarily responsible for important hormones. Studies have concluded that spay and castration functions as a very efficient endocrine disruptor. Typically, the most common reasons for neutering our dogs include population control, medical reasons and behaviour reasons. So let's talk a little bit more on those. I'm sure we've all heard of the more common medical benefits or reasons for spaying or castrating your dog. And those are, for the girls, the one many of you will have heard of as pyometra. Pyometra is a life-threatening infection of the womb. The more seasons that your dog has gone through, then the higher risk they are of developing pyo. By spaying and removing the womb, you obviously drastically decrease the risk of pyometra, with only a rare incidence of pyo developing on the stump in a surgically altered dog. The risk of pyo is also decreased in female dogs which has had a litter of puppies. The other big one in girls is the decreased risk of mammary tumours if the procedure is done before a certain age. If the spay procedure is undertaken before the first heat cycle, then the risk decreases to between 0 and 5%. The risk increases to around 8% if done after the second heat cycle, and by the time the dog reaches 2.5 years old, then the spay offers no decreased risk benefits regarding mammary tumours. In males, castration offers a decreased risk of testicular cancer because, of course, we're removing the testicles, and castration also offers a decreased risk of prostate disease. Other health benefits in both males and female dogs include a reduced risk of perianal fistulas, and in male dogs there are studies which suggest that castration may offer a reduced risk of diabetes, but this data is currently inconclusive. Now, while that all sounds great, let's take a little minute to consider the flip side of the coin. Because, like anything else, there are pros and cons to neutering, and it is worth considering the cons too before we go permanently chopping off body parts from our dogs. Now, whilst we do indeed decrease the risk of certain diseases and cancers in both male and female dogs by neutering them, the lesser talked about part of the story is that we also increase the risk of other diseases, cancers and ailments. In male dogs, castration, if done before 1 year of age, significantly increases the risk of osteosarcoma, which is bone cancer, which is a common cancer in medium to large dogs with a very poor prognosis. It also triples the risk of hyperthyroidism, increases the risk of progressive genetic cognitive impairment, triples the risk of obesity, a common health problem in dogs with many associated health problems, increases the risk of other cancers, including prostate cancer, cancers associated with the heart and blood vessels, and urinary tract cancers. It also increases the risk of joint diseases such as hip dysplasia and cranial cruciate ligament rupture, and it increases the risk of adverse reactions to vaccinations. In female dogs, spaying, if done before 1 year of age, significantly increases the risk of osteosarcoma, which is bone cancer. As well as that, it increases the risk of other common cancers, including cancers of the blood vessels associated with the heart and spleen, triples the risk of hypothyroidism, increases the risk of obesity, causes urinary spay incontinence in 4 to 20% of female dogs. It increases the risk of persistent or recurring urinary tract infections, increases the risk of recessed vulva and vaginal dermatitis, especially for female dogs spayed before the first season, increases the risk of urinary tract tumours, increases incidence of joint diseases including hip dysplasia and cranial cruciate ligament rupture, and increases the risk of adverse reactions to vaccinations. Now that's a lot to consider, isn't it? The best advice I can give when considering the health implications of spaying or castrating your dog is to consider the individual dog in front of you, do your own research on both the pros and the cons, and then talk it through with your vet. Now, moving on to behaviour. Let's once again look at both sides of the coin and discuss the pros and cons of neutering in relation to behaviour. And this is where things get a little bit more complicated, so bear with me while I try and simplify it as much as possible. Let's first talk about spay and castration in relation to controlling behaviour or as part of a behaviour modification plan. The typical behaviours said to be controlled or improved by neutering include roaming, urine marking, mounting or humping, and aggression, which classified broadly includes owner-directed aggression, stranger-directed aggression, and dog-directed aggression. Now then, whether altering your dog is going to be beneficial in terms of part of resolving or improving a behaviour problem is going to be partly determined by the motivation or the drive behind that behaviour. So if we take roaming as an example, which is a common reason given for altering male dogs, so if the dog is roaming because it's motivated by a sexual drive, in other words, he smells a girl and he in the area, and then studies show that removing the sexual glands, his balls, can often but not always remove that urge to roam. However, roaming is not always driven by the same motivator. If we take our overseas street dogs, for example, who are commonly imported and adopted into UK family homes, then the motivator for roaming is often different and not of a sexual drive, in which case neutering wouldn't show any benefits on the behaviour. A very obvious example from aggressive cases, where we may considering altering as part of a behaviour modification plan, is where a female dog only shows aggression when she's in season. In these circumstances, she may see a positive result from being spayed by removing the hormones which are responsible for her heat season and consequently driving the aggression. Okay, so let's talk more about aggression just for a wee quick minute. Science tells us that aggressive behaviours are influenced by a whole number of things. It's really quite a complex subject. But one of those things is hormones: testosterone, cortisol, serotonin, estrogen, and so on. These hormones all play a vital role within the body and have more than one role. Cortisol, as we know, plays an important role in regulating the body's stress response, as well as helping control the body's use of fats, proteins, and carbohydrates. Testosterone, as we all know, affects sex drive, but it appears to also have an effect on cognition, and in fact, there's now research to suggest that testosterone may modulate the processes of olfaction and arousal. These hormones play a role alongside many other things to control your dog's ability to make decisions, how they learn, how they act, how they respond, and how they feel. So, when it comes to aggression and behaviour in general, these hormones all play a role. Where you have a dog, for example, that is displaying dominance aggression and is generally self-confident, has levels of high testosterone, low cortisol, and low serotonin, then in these circumstances, neutering may be beneficial. But, of course, there is a flip side, where neutering could make things worse, make life harder for the dog, or could escalate aggressive behaviours, and as such, spay or castration may not be beneficial for the dog. If the dog's aggression is based on low confidence, fear, or anxiety, for example, once we whip those ovaries or testicles out, then we're also removing the chemicals which were helping to support the fearful, low confident, or anxious dog through his stressful life. And in these circumstances, studies show that spay and castration could make the problem significantly worse. And interestingly, when it comes to our rescue dogs, new studies suggest that neutering dogs during that transitional process into the new home may actually be making things much more difficult for them and be more detrimental because of that imbalance or change in the hormones which we're creating, and that it is more beneficial to undertake the procedure after the dog has settled into the new home. So whilst we can tick the box for population control, we may in fact be causing more problems in the medical and behaviour boxes. Large-scale studies have showed us that spaying or castrating your dog can have a negative impact on behaviour, and that includes increased aggression towards strangers, increase in fearful behaviours, increase in hyperarousal, an increased sensitivity to touch in female dogs, and increased aggression towards dogs, and decreased levels of trainability. One particular study concludes the overall trend seen in all these behavioural data was that the earlier the dog was neutered, the more negative the effect on behaviour. So to summarise, when we spay and neuter our dogs, like anything else, there are pros and cons to it, and as dog owners and guardians, it is our responsibility to do what is best for the dog in front of us. So we have to consider 1. Population control and the implications and responsibilities associated with an intact dog. 2. The health implications, both the pros and the cons. And 3. The behaviour implications. And whilst we consider all of that, we must also take into consideration the individual dog sat in front of us, their history, their health, their lifestyle, their breed, their genetics, what conditions or behaviours they might be predisposed to, the behaviours or challenges which they currently have, their environment, their handler, and their handler's capabilities. So as you can see, blanket rules or advice just don't work when we're considering spay or castration. When it comes to neutering, it's slightly more complicated than just whip them off or whip them out. So take the time to consider both the pros and cons for the individual dog and you, because once a procedure is done, they can't be put back. I really hope this gives you something to think about. I'll see you later.